I am thrilled with today's speaker. We have Dr. Mark Hyman, who is effectively one of my most favorite people on the planet. And really probably does not need an introduction for the listeners out there, but I will give him one as it is. He is it 8 New York Times bestsellers, or have we moved up since that was last? Okay, 8 New York Times bestsellers, his most recent one, The 10-Day Detox. He's the chairman of the Insititute of Functional Medicine. He has a clinic, the UltraWellness Center in Lenox, Massachusetts. He's been on the Katie Couric show, and now I think is going to be part of the Dr. Oz show, unless that's a big secret I hope to not be spoiling. All right. Editor of the Huffington Post, the list goes on and on. Linus Pauling Award winner. Really the person who I believe has helped bring functional medicine to the mainstream and really is the pioneer leader of getting the message out.
The thing is, Amy, so many people suffer needlessly, and that's what drives me. I see people not getting answers to problems that they have. Often autoimmunity is one of the biggest issues people suffer from.
I came to you with my autoimmunity and had many of the experiences that you had. I had spent a lot of time in China, was a vegetarian, and then went into eating fish and was eating lots of tuna. I think we have similar genetics with the MTHFR, not clearing that, being a vegetarian. So I too had a similar experience to you, and you helped me get out of that boat, and now it's my mission to help others as well. So what are, in your 15 plus years practicing functional medicine now, have you seen a rise in autoimmunity in your clinic?
Oh, yeah. We treat a lot of it, and I think there's a whole continuum of imbalances that go from mild to moderate to severe to deadly. My role is really to sort of look at that whole spectrum, and when you look at that whole spectrum, it's dramatically on the rise. In fact, there's about 9 million people with cancer, 22 million people with heart disease, there's 24 million people with autoimmune disease, and it's on the rise. So when you take that as a collective problem, and you look at them together, there's 80 autoimmune diseases, it's such a huge problem that people haven't sort of seen it as one problem, and there's no sort of autoimmune society with Insititute. There's like all these different pieces that are treated and looked at by different people, and nobody's looking at the problem as one whole continuum of an issue.
Why is it not getting diagnosed? Why is it so fractured? Why are the healthcare costs so expensive?
Most doctors aren't really aggressively looking for it, and they wait often until the symptoms are dramatic or extreme. What is autoimmune disease? It's an inflammatory disease. Why is the immune system so pissed off? That's a question that most doctors don't ask. So what we do in conventional care is we block, antagonize, suppress, and inhibit the immune system. We use inflammatory drugs like nonsteroidals, whether it's Aleve or Advil. We use steroids. We use drugs called TNF-alpha blockers, or called disease-modifying drugs that suppress immunity and can cause cancer. It can cause overwhelming infection. We use chemo drugs, methotrexate, Imuran, cyclosporin. We've been using bone marrow transplant for some people. So these are like extremely aggressive, extremely intense drugs with tons of side effects. Listen, if you could take a pill like a vitamin or a very mild drug that didn't really have all the side effects and it cured autoimmune disease, great. But we don't have that. And so the problem is there are a lot of approaches that are being missed, and doctors don't really think there's a cure. In fact, I just saw a patient yesterday who I've been seeing for almost a decade, and she came to see me. She had severe rheumatoid arthritis. Her autoantibodies were her ANA was 1 to 1280, which is a very high number. She had severe joint pains and rheumatoid arthritis. She had migraines. She had irritable bowel syndrome. She had terrible fatigue. And which is common with these people, but they just treat everything separately. So you see the neurologist for the migraine, you see the GI guy for the irritable bowel, you see the rheumatologist for the autoimmune disease, and they're really all connected. So we had to kind of fix her gut, get rid of the gluten, get rid of the mercury, and over time, she's completely normalized. She's 65 now, and she's healthier than she's ever been. She has no autoantibody. Her symptoms are completely better. She's had no migraines in years and years, no irritable bowel, full of energy, and no autoimmunity at all. So most doctors don't even think that that's possible, and they don't even bother checking the autoantibodies if they've been diagnosed initially because they figure they're just, never going to go down. But they do go away if you do the right thing, if you get to the cause.
The way we treat autoimmune disease today is criminal. Mm-hmm. It's one, the cost is enormous. Two, the cost to human life in terms of suffering and complications and the lack of effectiveness is enormous. And three, there are better treatments that work better. I just saw a woman a couple of days ago in my office who had ulcerative colitis. She was on a TNF-alpha blocker, which cost $30,000 a year. She was in the hospital 12 times the year before she saw me. She came to see me, and she's not been in the hospital at all, and is off all her medications and feels good. You know, this is something we just don't see, right? I had a woman come to me who was going to have her colon taken out. 2 or 3 patients in the last year were going to have their colons removed, which is a very serious thing. They cost me bag. It's a lot of healthcare costs. It's a surgery. It's a quality of life issue. This is so much that's impacted by that. And I said, just give me 6 weeks. Every single one of them are great.
So you talk about getting rid of the bad and putting in the good. That's kind of, I hear you say that a lot when I hear you speak.
The most common thing is food, right? So gluten and dairy are number 1 and 2, and grains are a close second. So those are the things I start with. And then if there are individual tests we do, we can tell if people are triggered by different things. We'll do sensitivity testing. But those are very big. The second is problems with your gut, leaky gut, and leaky gut's a big problem. What is leaky gut? Well, your cells are all stuck together with these like Lego-like connections like this, and various insults will cause the cells to separate, and food and proteins and bacteria and things to leak in, and your immune system doesn't like that. It's like, that's not me, I better do something, right? So the things that cause a leaky gut are gluten is often a big trigger, stress is a big trigger, our poor diet, which causes overgrowth of bad bugs, creates inflammation, that's a trigger, antibiotics, anti-inflammatory drugs, steroids, birth control pill. A lot of drugs will cause changes in the gut flora that lead to a leaky gut. Environmental chemicals, toxic metals cause a leaky gut. That's what happened for me. I had a terrible leaky gut caused by mercury, because mercury binds all the enzymes. You can't function properly, and so you end up having all these problems. So I think it's really important to understand that we really have a powerful capacity to function better if we fix our gut. So that's one of the key things. And then heavy metals and environmental toxins, another big category, and mercury particularly, lead, a big one, and then infections. So things like Lyme, viruses, things like that. So those are the things that I focus mostly on. There's a few other things like mold or stress, but I think those are the big things. And I think we get rid of the bad foods like gluten, clean up the diet, and deal with the gut flora, heavy metals, infections. We really can deal with a lot of autoimmunity. And the things we want to give people are, the right nutrients that are important. It's healthy gut flora, bacteria, fish oil, vitamin C, vitamin A, vitamin D, zinc. There's a number of herbs we use, quercetin, curcumin, various anti-inflammatory compounds that help regulate and heal the gut.
I believe you mentioned mold as being a source potentially for people with autoimmunity.
So you take a good history, and then there's tests you can do to identify the body's response to mold. You can look at antibody tests to mold. You can look at mold toxins in the urine. A lot of the good tests for mold, the IgG and other tests, the labs have been shut down because the insurance industry doesn't want people to actually measure it, because if they measure it, they can document that the person's been exposed. You can match it to the molds that are in the house, and there's insurance claims that happen out of it, and then they don't like that.
Yeah,
it's a problem. And for those who are interested in learning more about this, there's a great website called Surviving Mold by Richie Shoemaker, and it's a great resource for people who are interested in this.
But, besides maybe you or Dr. Perlmutter, there are not a lot of people I find in functional medicine really talking about all the grains and legumes. So can you tell us your perspective on that, of how that's creating problems for people?
There are 2 factors involved. One are cross-reactivities, where people will have cross-reactions to other grains that are not gluten grains. And like corn. Like I had a guy come in yesterday who was like, I got off gluten and everything. I was eating lots of corn. My psoriasis is going crazy. I didn't know what's going on. I got off the corn, my psoriasis went away. Right? So there are factors like that. And second is that the nature of your gut flora depends on what you're eating. And a lot of people have bacterial overgrowth, yeast overgrowth. And if you eat a lot of grains and starch, the bacteria that are bad bugs will ferment them. So if you have good bugs, then you can eat a lot of grains and it doesn't cause a problem. If you have bad bugs, you're kind of feeding the bad bugs. So it creates a problem of bacterial imbalances and yeast imbalances in the gut that lead to a leaky gut. So those 2 things I think are factors, cross reactions. And so I feel the best way to treat people is to do a reset. If you can do incremental stuff, it may not work. Let's say you're allergic to gluten and dairy and corn. And you take out gluten and dairy, but you keep eating the corn. Well, you're not going to get better. Even though you've gotten rid of the 2 big things that are causing a problem. You might get a little bit better, but not significantly better. So the key is you have to sort of reset and take everything out that could be a problem and then add things back in. And that's what I do. So I'm always focusing on the cause. And I think, will I not give somebody a symptomatic treatment to make them feel better? Absolutely, I'll try it. But I don't think it's the panacea, and I think it's helpful, but it's not a miracle drug.
So used as an adjunct while you're finding the root cause to help somebody with symptoms.
Yeah, I think the problem with a lot of people who practice integrative medicine or functional medicine is they'll hear about something and they'll think that's the thing, instead of really thinking and linking. What I call is thinking and linking instead of naming and blaming. So you have to think about the cause and you have to link everything together, see the patterns that connect. And then you can use whatever treatment you want, but you've got to really keep thinking about what's going on in your